So we have a patient here, which is an adult patient with a sinus venosus ASD. So the nice thing about the program is we can go through slices on the CT, which is very useful for us that we're used to do this in 2D images. So it's a nice review. You can see the SVC and the anomalous pulmonary veins coming off there and going into the left atrium and the SVC. So at this time, we would like to see an easy way to segment this in 3D. So the quick way I'd like to do it is going to images and volume rendering. So we can see the patient right there already on the table. And then there's an automatic option of cardiac hollow, but there's other options if we have an MRI or we have a specific areas that we're interested in. There's a cardiac CTA, and we just need to change our contrast and we can show our heart already here. But I like the cardiac hollow because for these patients, we really need to understand what's happening inside the heart. And you can change the contrast same way. So at this point, we can go without plane. It's gonna cut through the segmentation and be able to see inside. We can also hide more structures, but I'm gonna do this as a quick demonstration. We're going into the heart here. And if we go to the setup here and go to reset, it's gonna show us the presets that we have for this patient. And we can change to make it more hollow, less hollow, whatever we need here. So I'm gonna keep it in this view and we can have a sense of the SVC, the anomalous veins, the defect back there, and there's a secondary defect here. So this is a very nice way of seeing this. And then anomalous pulmonary vein coming into the SVC. Again, we can change more of the features here to see more or less of what we need inside. I like to see this from the left atrial side. So we're gonna rotate the model, so we can do that. We're going here into the left atrium. You can see that's the aorta. And as we keep going, we can see the anomalous veins. So this is the veins, and those are the anomalous back there coming into the SVC. So we can rotate the model a little more. Use our plane again and see those structures. SVC, the anomalous vein, very nicely shaped. And then seeing how it can be baffled into the left atrium. And those things are useful, but then the next part is planning, right? So as we have here collaboration ongoing, do you mind bringing up the stent? There we go, thank you. So at this point, I want you to see the options that we have. So we have that stent enable, but we have different type of stents built in. So we have the G-armor stents because of the length that we need for sinus venosus and what is available in the US at the moment. We're in 2025. So in this patient, I'll go for one of the longest ones. So 10 sig, 8.2 centimeters. The nice thing is that we are using the tables used at the bench of the shortening of the stent with certain diameters. So right now the initial one is 12 millimeters. So at this point is 7.8 centimeters length. And that's going to change as we work with it. So I'm gonna bring it here in view. So I'm going to go up to a more realistic diameter. So I'm gonna be like in the mid-20s here. I'm going to bring the stent into the SVC and see that that most likely is like what we are going to use given that the SVC is very compliant. But I'm going to decrease a little bit to make sure, there we go. I like that better. We have the innominate vein up there, and we know that we use that as a anchor in many patients of this. And then we need to make sure that we're covering the SVC, the actual defect. So I'm gonna bring it down a little bit, but then we don't have contact yet. We have to make that flare, so we can anticipate for that as well. So we can flare at the end and flare from end length and from the start end length. Um, so we can change that here very easy. We can see the flare that opposes into the walls, and that to me looks really good. But then what is the final sizes? So I'm gonna say the 82 diameter was a good one. So I like that. And then the diameter here is around 19, 20. And then the lower diameter is closer to 33. So we can anticipate that we're gonna need to balloon at that area with a 34 balloon or so. And then we may need to implant it with a 20 or 22 balloon. And that's very helpful to plan on the case. That was the quick way. But I'm going to go now to hide the volumetric. And if we actually have the time to segment things, we can show the segmented heart. And it's the same way. We can see this in a very nice shell with colorful segments, and we can see the SVC. We can see how the veins are there, and it's gonna be baffled in the back. And we can see that we're not covering that ASD, which is pretty low. So if we want to cover that for this defect, that's not a sinus venosus, but a secundum ASD, then we need a different approach. We can see here the stent in the SVC. Very nicely having those pulmonary veins baffled to the left atrium and covered that secundum ASD. And this is just a nice demonstration how we can find that stent, the right fit, the right size. We see that with that length, we're gonna be at the azygos here, but we have good seal. We can bring that stent down a little bit more if necessary. So then we have the right length stent and an anticipated size of the balloon that we will need to mount it. I like the transparency. Can we show that for the right atrium? There we go. That's a nice way of seeing that and having the anatomy and highlighting that part in the anatomy there as well. This is just very nice to learn, especially for our trainees, how those veins are going to be baffled with that stent and when we have to make sure that we're protected and we don't compress. That's why we need to have pulmonary vein protection in many cases. Can we create transparency for the left atrium too? We can see that in a minute, so we can see there the structure, so we can see that other defect. If I want to bring it down, we can see what it would look like. Like that's a very low area, and we can miss the anchor. So I think that position is still very good. And we're thinking that we need to flare more, so we can still do it. And go to right to planning tools and flare that even further. And we can erase that measurement, that other measurement at the moment. You can see how nice that looks. So that's a nice stent planning tool.